What about the cholinesterase reactivators in large animals? The efficacy is question mark once again, because in small animals we can give the sufficient number of the doses, whereas in large animals it costs too high. And also sometimes what happens is, if it is not properly confirmed that it is a specific toxicity, then oximes, they themselves may become the toxic material to the cattle. And so many preparations are available. Here is the dose, 20 to 50 milligram per kg, slow IV, and repeat it whenever the clinical signs reappear. That is how. Whereas the carbamates will low toxic, and the antidote is once again it has not got any antidotes, just like atropine and the cholinesterase reactivators, not to be administered in the carbamates poisoning, the similar clinical signs. Whereas the carbamate poisoning, atropine sulfate itself is enough, we need not administer the 2-palm or any other thing. Whereas in case of human practice, the modern drugs have been arrived with more costlier drugs in the clinical management of many of the poisonings. So, synthetic pyrethroids, they will have, once again we are doing the mistake of administering the atropine sulfate in synthetic pyrethroid, just like dipermethrin, this cypermethrin, deltamethrin, and so many methrins which are ending. So, butox is one of the thing, and many times the farmer apply it overdose, and sometimes the animals drink the preparation which is made ready, and you are getting the toxicity episodes. And apart from this one, Began, cypermethrin and transfluthrin, and this is the very developing area, especially the pyrethroids. Every 1 month, a new pyrethroid is being poured into the market, especially in the Indian market, and as the insects have become lot of resistance, they have developed the resistance, just like our this bacteria, etc., virus, etc., they have developing the resistance. Hence, new and new compounds are there. For synthetic pyrethroid toxicity, there is no specific antidote, that you have to remember very properly. Then atropine sulfate can be used under a very low dose whenever there is severe salivation, or salivation will not make any difference for us, to stop that salivation. So that if salivation is too much, means it may cause a transient electrolyte imbalance, that is why you can administer, or else it is not required. Whereas the convulsions, etc., can be treated with the routine anticonvulsants. Whereas the allergic reactions may also happen, especially if it is applied on buffalo skin, and sometimes some of the animals, especially the local cattle, they exhibit the allergic signs. Hence, at that time antihistamines and total washing up of the skins may be required. Always the fluid therapy with ringer lactate and 5% dextrose is recommended. In any of the toxicities, maybe the dose is very high, and you can go for the regular treatment. And the amitraz, etc., they are all the miscellaneous insecticides, no treatment for this thing. You have to look after the treatment, especially drowsiness, etc. So, in this case, one should not administer the RID, etc., they are coming diazepam, because already there will be a depression, then the depression may increase and the animal may go coma. So, there is no specific antidote this thing, especially amitraz, it is coming as 12.5% in agrochemicals, whereas in case of veterinary practice just 1 or 2% it is there. So, it may happen. Rodenticides are the chemical used to destroy the rodent pests. Rodents are also pests. All the rodenticides, they are also pesticides. So, so many metric tons of the food is being destroyed by the rodents. 10% of the Indian originated grains are being destroyed either during the growth phase or during the storage phase. So, it is causing more than $800 billion especially in the to the world as such. So, that is a very high loss is being caused by the rodents, and there are lot of rodenticides are there, and many times the rodenticides are also sold on the roadside for 10 rupees, 20 rupees, etc. So, warfarin is one of the oldest rodenticide. It is also one of the important rodenticides. Continuous ingestion of the warfarin causes total inhibition of the clotting factor. So, the animal will die due to the internal hemorrhages, especially gums, and there will be epistaxis and massive internal hemorrhages, blood discharge from all the organs, which is very similar to that of the anthrax, etc. Many times it happens. So, and another thing is, this is Martin rat kill. Many times the owners will keep them as the bait to the rats, and the cattle will go and ingest, or many times the cats or dogs may also succumb to the toxicities. Bromodiolon or Martin rat kill, the active principle is there, and such type of the clinical signs, especially the bleeding from all orifices, or from the eye, the ear, and the anus, everywhere the orifices will have, and also subcutaneous hemorrhages will be seen, and sometimes the conjunctival, subconjunctival hemorrhages will be seen. And zinc phosphide is very commonly occurring toxicity in field conditions, because it is available to the farmers with 10 rupees, 20 gram is easily available, 10 to 20 rupees. So, they will offer it as a rat bait, and accidentally it is caused, and sometimes the malicious poisoning, purposeful poisoning is also caused by the zinc phosphide, a black powder. So, the clinical signs are very apparent, just like 1 to 3 days of the consumption, and clinical signs include blood discharge from the orifice, aimless running in case of the dogs, etc., because of the phosphine gas which is produced in the rumen, and especially to the treatment of non-anticoagulant rodenticides, vitamin K, or it is available, human preparations are also available, or phytomenadions are always available. Then several repeated doses are required, because once the clotting factors are destroyed, it is very difficult to get them regenerated unless you transfer the blood to the animal. So, vitamin K has to be repeatedly administered to such cattle, and blood transfusion is one of the best method to make the animal recover, especially in case of the warfarin or other poisoning, whereas the zinc phosphide is the mechanism is totally different. The toxic gas, the phosphine, is produced in the rumen or abomasum, then it will enter the circulation, then it will stop the entire cellular process. Hence, the toxicity is very what you call as the clinical signs will be non-specific, very non-specific. Colic is observed in case of dog, aimless running, and the bloat is seen, because there will be, and the animal will be, exhibit the symptoms of the colic recurrently. Colic is very rare in case of the ruminants, of course, unless there is a block, etc. But here the recurrent getting up and down and all these things will be there, and the important thing is carcass will never decompose even after 7 to 8 days, because the phosphine gas is one of the most potent antibacterial in nature. So, it will kill almost all the pathogens, especially decaying. So, this is one of the episode of zinc phosphide toxicity. In this is done, the research is done by Dr. Renuka Prasad sir, when he was the director of IH and UB. The carcass was buried, and it was suspected that it is malicious poisoning is there. Then they opened the carcass of that particular elephant, and they have seen that the exhumed carcass was fresh without any decomposition after 7 to 8 days. This is the characteristic sign of the zinc phosphide poisoning. So, this is seen, see, after exhumption of this carcass, after 7 or 8 days, the carcass is as fresh as today it is being died. So, this is one of the characteristic feature of the zinc phosphide poisoning. Even ruminal contents also, they will be fresh, because all the gastric microflora will be dead, and there is no production of any of the gases or decomposing material, especially in the zinc phosphide poisoning. Even with the liver, etc., the elephant malicious poisoning will be always done, especially in the zoos. There will be a tug of war between the higher ups and lower persons, and always they are doing the malicious poisoning, and very commonly available, because they do not have the knowledge about the other pesticides. Easily available pesticide is the zinc phosphide. They will bring it and offer it to the cattle. or especially the zoos, if anybody has got the opportunity, then first we have to suspect the zoo animal toxicity. Most of the time it is due to the zinc phosphide. In Mysore Zoo, many of the elephants died and other animals have been exhumated, then it is positive for the zinc phosphide. And malicious poisoning is also done in case of the villages. Usually whenever the pesticides are used, it will have lot of bad smell and the cattle will not consume sometimes. But this is not having any bad smell, bad odor, etc. So the cattle will easily consume. Just like the congestion of the mucosa, cyanotic tongue, this is the tongue of a elephant. Usually one teeth of an elephant will weigh 4 to 5 kgs and the total weight of an elephant is about 4.5 to 5 tons weight is there. In endocardial hemorrhages, lungs, emphysematous will be there, large intestine with ecchymatic hemorrhages. Especially in case of large animals, there will be severe abomasal ulcers will be there, then erosions of the intestine, sometimes the perforation will also be there. That is how we can see and we can test it. In the laboratory, there are very easy tests are there and we can do it, zinc phosphide spot tests and confirmatory tests are both are available. Whereas the fungicides, when compared to the other thing, they are not so poisonous when compared to the